Hello friends and dear students, welcome back to my YouTube channel SS Pediatrics. My today's topic is APGAR score. APGAR APGAR score. मेरे एक व्यूअर ने मुझसे रिक्वेस्ट किया था, काफ़ी टाइम हो गया इस चीज़ को, आई एम सॉरी बट आज मैं आपके पास ये वीडियो लेक्चर लेके आई हूँ APGAR score. APGAR score is a test which is developed by Dr. Virginia APGAR. And in this the vital of a newborn baby is to be assessed, and it is a very quick assessment which is to be done at the 1 minute after the delivery of the newborn baby and at 5 minutes after the birth of a newborn baby, and it is a quick assessment of the vital rates of a baby. The total score of this APGAR score test is 10, and on the basis of the score we used to just mention that regarding the health status of a newborn baby. As much as good the score out of 10, the health condition of the baby is good. So in detail मैं आपको वीडियो लेक्चर में बताऊंगी APGAR score के regarding. So let's start with the topic APGAR score. Start with the topic APGAR score. Start with the introduction. APGAR score is a test which is developed in 1952 by Dr. Virginia APGAR, and this test is the baby's first test, and in this the baby is quickly assessed for the overall well-being of a newborn baby, and this test is to be performed at 1 minute after the birth of the baby and 5 minutes after the birth. This test rates the 5 vital areas. Why is this test is to be done? To assess the baby's vital signs quickly after the delivery, and the score is helpful for the later evaluation of the baby. How does the APGAR score work? The APGAR scoring system is divided into 5 categories. Each category receives a score of 0 to 2 points. At most, a child will receive an overall score of 10. However, a baby rarely scores a 10 in the first few moments of life. This is because most babies have blue hands or feet immediately after the birth. APGAR scoring system, you can see here the full form of APGAR: A for activity, P for pulse, G for grimace, A for appearance, and R for respiration. If the baby is showing no activity, then 0 point will be given to the baby, and for flexed arms and legs 1 point, and for the active movement 2 points. For pulse, if absent, then 0 point, below 100 beats per minute then 1 point, and over 100 then 2 points. For the grimace means for the reflexes, if the baby is floppy then 0 point, and if the baby shows minimum response to the stimulation then 1 point, and if the baby show proper response then 2 points. For the appearance, in this we use to check the skin color. For blue and pale 0 point, pink body, blue extremities 1 point, pink body 2 points. For the respiration, if absent then 0 point, slow and irregular 1 point, and vigorous cry then we have to give 2 points to the newborn baby. As I already explained, A is for activity and muscle tone, 0 point for limp and floppy, 1 point for limbs flexed, 2 points for active movement, P for pulse or heart rate, and G for grimace, and the same as I explained in the chart. A for appearance and R for respiration or breathing, as I explained. The APGAR scores are recorded at 1 and 5 minutes. This is because if a baby's scores are low at 1 minute, a medical staff will likely intervene or increase the interventions already started. At 5 minutes, the baby has ideally improved. If the score is very low after 5 minutes, the medical staff may reassess the score after 10 minutes, and doctors expect that some babies may have lower APGAR scores. These include, what are the reasons which include the low APGAR score of the baby? First is premature babies, babies born by cesarean delivery, babies who had complicated deliveries. What's considered a normal APGAR score? A score of 7 to 10 after 5 minutes is reassuring. A score of 4 to 6 is moderately abnormal. A score of 0 to 3 is concerning. It indicates a need for increased intervention, usually in assistance for breathing. A parent may see nurses drying off a child vigorously or delivering oxygen via mask. Sometimes a doctor, midwife or nurse practitioner may recommend transferring a patient to a neonatal intensive care nursery for further assistance. Many doctors don't consider the APGAR scoring system to be perfect. There are modifications to this scoring system, such as the combined APGAR score. This scoring system describes not only the baby's APGAR score but also the interventions an infant has received. The maximum score of the combined APGAR score is 17, which indicates a baby who hasn't received an intervention and receives all points. A score of 0 indicates the baby didn't respond to the interventions. Results: 10 out of 10 is a perfect score for this APGAR scoring, and the higher the score, the better is the condition of the newborn baby, and the score over 7 indicates good condition and the score of 10 is unusual. A score less than 7 may indicate some medical assistance which is required by a baby for the better hemodynamic stability. Limitations of this test this test is to be performed immediately after the birth, and this is a very quick assessment and does not necessarily indicate a baby's long-term behavior. So this is all about my today's topic, APGAR scoring. So I hope you all were clear with the topic, and if you want to listen some more lectures regarding the pediatric nursing, so then please subscribe my channel SS Pediatrics and like and share my videos. Thank you.